Hello everyone. In this video we're going to be talking about the pathology of pulmonary hypertension. So let's start. So what is the definition of pulmonary hypertension? So it is a condition where there is mean pulmonary artery pressure greater than or equal to 25 mmHg at rest. Normally it is less than 20, somewhere around 12. Now what are the causes of this disease? So the causes can be divided into two groups, primary and secondary. So let's start with the primary causes first. So the pulmonary hypertension caused here is usually seen in young females. Here there is mutation in the BMPR2 gene. The full form of it is bone morphogenetic protein receptor 2. Earlier it was thought that this gene was involved only in bone growth, but later scientists found out that it is also involved in apoptosis, cell proliferation and other stuff. So let's see what exactly happens if there is mutation in the BMPR2 gene. A mutation in this gene will lead to proliferation of the smooth muscles of the arteries. And you can imagine, if there is proliferation of the smooth muscle layer in the pulmonary arteries, it will increase the resistance to the blood flow and hence it can cause pulmonary hypertension. So important to remember, mutation of the BMPR2 gene. Now what can be the secondary causes? There are a lot. So for example, having an obstructive or interstitial lung disease will lead to the obliteration of the alveolar capillaries and hence leading to pulmonary hypertension. Even mitral stenosis can cause this. Let's see how. So what happens in mitral stenosis is that the mitral valve, which is between left atrium and left ventricle, gets stenosed or narrow. Due to this, the blood will not be able to go from the LA to the LV, and so the blood will keep on collecting in the pulmonary vessels. Soon, the blood will also start to collect in the pulmonary arteries, leading to pulmonary hypertension. Some of the other causes include hypoxemia. To understand this, you need to know that normally whenever there is hypoxia in any other part of the body, there is vasodilation. Why? So that more amount of blood can go there and more amount of oxygen can be provided. But in the pulmonary circulation, it is opposite. Here, vasoconstriction takes place. Recurrent thromboemboli can also cause pulmonary hypertension by causing obstruction to the blood flow. Diseases such as scleroderma lead to increase in vascular resistance, causing pulmonary hypertension, and also obstructive sleep apnea. Now, what are we going to see on microscopy? There are two terms here that you need to remember for the exams. There will be medial hypertrophy of the pulmonary muscular and elastic arteries, and also plexiform lesions will be seen. So these lesions are a group or a tuft of capillaries which originate from the remodeled pulmonary arteries. So both of these terms are important to remember. Now what are the clinical features that you will be able to see? There will be dyspnea on exertion, and let's understand why. Coming back to this diagram, as we just saw, there is high pressure in the pulmonary arteries. Due to this, the right ventricle will have a hard time pushing blood into the lung and consequently to the left ventricle. This will lead to a decrease in the cardiac output. And decreased cardiac output means less oxygen delivery to the tissues. Now imagine you tell a person with pulmonary hypertension to exert themselves, meaning you tell them to do some work. So this will lead to an increased oxygen demand by the muscles, and already the oxygen supply to the muscles is less. So you can imagine why the patient is going to face difficulties doing this. Now you will also see fatigue, there can be chest pain, there may be syncope also if proper amount of oxygen is not able to reach the brain. The pulmonary edema component can increase so much that it can lead to respiratory distress. And finally, a major complication named corepulmonale. Let's try to understand what corepulmonale is. So it is a condition where there is dilation and failure of the right heart because of high pressure in the pulmonary artery. Let's try to understand this with a diagram. So again, there is high pressure in the pulmonary arteries. Now because of this high pressure, the right ventricle will have to push with more force to overcome this pressure and push the blood forwards. This will lead to hypertrophy of the right ventricle. But if the pressure remains constantly high, at one point the heart will not be able to keep up and will fail. So then this condition will be called as corepulmonale. Now what all features can this condition cause? There can be increased jugular venous pressure. There can be hepatomegaly because the blood will start to build up in the systemic veins. There can be edema and also ascites because of the same reason. Now, how are you going to diagnose this condition? So, this is actually a diagnosis of exclusion, meaning that you will have to do a lot of tests and exclude other diseases to diagnose a person with pulmonary hypertension. So, we can do an X ray which shows enlarged pulmonary arteries, and this is because there is an increase in the pressure in those arteries. We can do a spirometry test to rule out other diseases like obstructive or restrictive lung diseases. We can do antibody testing to rule out autoimmune diseases. We can also do an echocardiogram to see the functioning of the right ventricle. That diagnosis can be confirmed using a right heart catheter, which will measure the pressures of lung blood vessels. Now, what is the treatment here? We can use diuretics, which will lead to decrease in the circulating volume and help lowering the pressure. We will give oxygen therapy. We can even use anticoagulants because remember, thromboemboli are one of the main causes of pulmonary hypertension. And finally, coming to the last part of the video, we will even use vasodilators. And there are two groups of vasodilators that you need to remember. We can use endothelin antagonists and prostanoids. So the first group includes ambrisentan, bosentan, and macitentan, and some of the prostanoids include epoprostenol, treprostinil, and iloprost. So that's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.